7:10. Good morning. Now, when we talk about HIV, many think back to the 1980s and the "Don't Die of Ignorance" adverts. Thanks to advances in medicine, it is now a manageable chronic condition. But London's black communities face higher risks of a new diagnosis, with black women at a greater risk of getting HIV, that according to a new report. Susan Cole is the Executive Director at Phoenix Health Movement and joins us now. Good morning, Susan.
Hi, good morning.
Great to have you with us. The findings of this report won't come as a surprise to you. Tell me about your work with HIV and black women in particular.
Yes, so I've been working in HIV sector for probably about 25 years or so, and black women are disproportionately affected by HIV, particularly in London. And I think so much of that comes about, as you say, that people don't really realise that HIV has changed and black women don't feel that they're at risk.
Black women already face discrimination, don't they? Is there a risk that this report may reinforce stereotypes? It may just enhance that feeling of discrimination and that sort of stigma effectively?
I think black women face intersecting forms of stigma, discrimination and disadvantage. It's not just HIV where women are disproportionately affected. We know that black women are significantly more likely to die in childbirth. We're more likely to have certain cancers. We're more likely to be diagnosed late with cancers. So I think it's really important that we recognise this isn't anything that black women are doing wrong. It's really the fact that the system isn't targeted at black women, and we need to have more targeted services around HIV, more campaigns around HIV targeted at black women, so black women can know the risks and protect themselves.
I mentioned in the opener to this segment, there was that advert in the 80s, "Don't Die of Ignorance," and there has been a lot of stigma around HIV. Is there still a stigma relating to the illness? And is it what prevents some people maybe coming forward with it?
I think there is still... Absolutely. I do think there is still a lot of stigma around HIV. I think people do think back to the "Don't Die of Ignorance" campaign, but the reality is that HIV has changed. People on effective treatment, it's impossible to pass the virus on to sexual partners. Women with HIV can have children born free of HIV. People with HIV can do any job. But because of the lingering stigma, that might be a barrier often to people testing for HIV.
And tell us about your podcast. You've got a podcast discussing issues. Where do we find it and what's it all about?
Absolutely. So I've got a broadcast series called Positive Health that's streamed on the Phoenix Health Movement YouTube channel. We have this every month. We had one yesterday that's now available to watch on demand. We discuss with people living with HIV, healthcare professionals, decision makers like Florence Shalomi MP has been on. And we don't just talk about the risks of HIV, we also talk about the solutions and actions we need now so everyone can benefit from the progress that we've seen in HIV.
Susan, great talking to you this morning. Thank you very much for joining us. Susan Cole, Executive Director at Phoenix Health Movement, with us on Breakfast on BBC Radio London. 51% of new HIV diagnoses amongst black heritage individuals were made at a late stage, increasing the likelihood of adverse health outcomes. Don't forget, you can check out Susan's podcast wherever you get your podcasts from. 7:15. Good morning.